My name is Jessica Conwin, and I am the thyroid specialist here at Bethel Pharmacy. And so I wanted to do this video to really describe more about how I can help you. And so some of the top reasons why people will come to see me is because they've been told that their thyroid lab values are normal, but they still feel bad. And so that's pretty much all my clients that come to me. And so the thing, with when you're trying to get well, you can't just treat labs. You have to treat labs and as well as symptoms. And so when you come to me, I sit down with you for a minimum in the first visit of an hour, and I'm going over your health history. And so I'm looking for the reason of why. Why do you feel the way you feel? And so we call that root cause medicine or functional medicine. And so, when you come in and you're saying, I can't lose weight, my hair's falling out, I'm always cold, I'm constipated, I have heart issues, my heart rate is slow, my blood sugar's going up, cholesterol's going up, people come in with a long list of symptoms. I'm not overwhelmed by the amount of symptoms. My question is why? Why do you feel that way? Once I know why, then we can turn that off. And so when we're talking about thyroid dysfunction, there are a lot of triggers. Nutritional deficiencies is one, stress, toxic overload, chronic infections, and a leaky gut or intestinal permeability. And so I'm going to assess if those triggers are present by going through your health history with a thorough analysis. I use a variety of assessment forms and also lab work. And so we may have to schedule another visit for the lab work, depending on how much you have. But I want to go over your thyroid panel. I asked for actually a good body of lab work because so many answers are in the blood, and the blood doesn't lie. And so I look at that, but my perspective is different because I am a pharmacist. I'm not a medical doctor, so my training is different. And so as a pharmacist, we don't diagnose, but we're taught to prevent disease and manage disease, and ultimately to help diseases go into remission. So I'm looking for an optimal range. And so specifically when we talk about thyroid, you'll see that optimal ranges for thyroid values is where people don't have symptoms. So yes, your TSH could be less than 5. Let's say your TSH is 4, and so you're told that that's normal. Well, in my world, TSH shouldn't be above 2. Because that's optimal. People feel the best when their TSH is between 1 to 2. So that's an example. Or let's take a value like reverse T3, which is oftentimes not even tested for. And so you may have been told, hey, your reverse T3 value is normal, and it's 25. That is not normal. And if your reverse T3 is at 25, that tells me that you have low thyroid function. And so, so that's the benefit of when you're coming to meet with me. You're sitting down, with me for an hour. We're going through all of these things. I'm going over your health history with a fine-tooth comb to help resolve why you can't lose weight, why you're always cold, why your digestion is off, whether you have diarrhea or constipation, why your skin is dry, you have low sex drive. I pretty much give you an assessment form that you can tell me exactly how you feel. And a lot of times, a lot of people haven't gotten that ability to sit down and say, this is 100% how I feel. And finding and having somebody that's going to look past just how you feel, but into why you feel that way and address that. And so that's the benefit of coming to consult with me. So I have my office in Bethel Pharmacy in Tulsa, Oklahoma, but I do primarily most of my consultations over the phone and via Skype. So I'm available to you wherever you're located. We can consult in the comforts of your own home, and we communicate via email and fax as far as getting forms to and from one another. And so I would love to meet with you and to help you. I'm very passionate about helping people to not just live with the disease, but let's actually get rid of the disease. And by rid of, I mean like when we test your blood, you no longer show positive for whatever the issue or disease was when you came to see me. That's my goal, is to heal you, not just to cover up your symptoms. And so If you're interested in meeting with me and consulting with me, just click that link below and we will get you connected to me. Thanks for listening.